I'm well, thank you, and you, Tate.
I'm doing fine. It's been nice to review your CV. You're a registered nurse with a lot of diverse background. I have a few questions I'd like to bring to light your CV in a video format. Is that okay?
Yes, that's fine.
All right. So, what employers want to know first, Candice, is about the formal and informal qualifications. What would you have to say around that issue?
Okay, so my formal qualification is a bachelor's degree, so a B.Cur, um, with general nursing, midwifery, community, and psychiatric nursing.
Okay, great. And then could you repeat maybe some of those informal trainings you may have had along the time span you've been working?
So within our training, we do, other trainings along the way. We do CPR and first aid training that is required. We also do training on how to deal within the nursing field with, certain problems that come up. So within the community, um, religion training. So how to deal with people from different cultures, because our country is so diverse. So we learn how to deal within the different cultures and how the cultures work. Um, so that's sort of some of the informal training. And along the way as well, separate courses that we do. So with regards to maternity and midwifery, we do childcare, breastfeeding, antenatal, how to educate when we are training prospective parents.
Very good. Candice, what attracted you to nursing or to midwifery? Do you have an early memory from your life?
It's just something I have always been so passionate about. My mom is a nurse as well. So I do think it's some of that that has been passed down, but I've just never thought of doing anything else. I know when I applied to study on the form, they give you your first option and your second option. And I just remember thinking if I didn't like nursing, I had a bit of a problem because I've never thought of doing anything else. I didn't have a second option to put down.
Okay. Well, I'm glad you made it. What would be your core interest? The main thing you like, and how much time have you spent doing this main interest?
My main interest is maternal and child care or maternal and child health. Um, and within that, education. So educating prospective parents, so the antenatal part of it, the postnatal. Um, I have spent 5 years, probably formally 5 years, doing that. So working in a maternity ward and then working in a well baby clinic where we did antenatal classes. Um, and then when the parents bring the little ones in for vaccinations, you do a lot of education regarding the stage that that child is in. So milestones, what they can expect. And if there are delays in milestones, giving advice on how to maybe achieve them. And if there are problems, identifying and then referring to specialists as needed, whether it's a physio or an occupational therapist if needed.
All right, wonderful. 5 years in your core interest. And what set the base of that, Candice? What was some of the things that you've done leading up to that, like other sorts of focus?
So most recently, I worked in an IV bar where we administered IV therapies. I did that for 2 years. Prior to that, I worked for an orthodontist for 18 months where I did case discussions with the patients as well as training and then applying the orthodontic devices on the teeth. Before that, I worked in doctors' rooms, so following doctors' orders, doing what they'd asked, whether it's non-invasive tests, urine testing, pregnancy tests, doing ECGs, IV therapies, and just, following doctor's prescriptions. I also worked as a traveling nurse for an insurance company, where before you take out an insurance policy, they check HIV and draw other bloods. If there are problems, you do questionnaires and medicals as well. And just before that, I was doing my community service in a psychiatric hospital, where I was exposed to both forensic and acute patients, both male and female.
For employers watching this, is there anything else you'd like to say about yourself as far as coming into New Zealand and maybe your readiness? Anything at all you'd like to say?
Well, we would love the opportunity to be able to move to a country that has such a positive healthcare system, where it's great to work. We are ready. We have started this side getting all our ducks in a row. And, for us, we'd like to be able to contribute positively and build a future for our children, because ultimately that is what we all strive to do, is do what we can to make a better future for our children.
For any employers listening to this, I would encourage just to reach out to Candice Phipps and find out directly from her those things that you need to know in order to make a hiring decision. And Candice, you're available. I'll leave that information for them, for them to contact you. Is that fine? Email is fine for the start?
Yes, email is perfect.
Yeah. Okay. Thank you for your time, Candice.
Thank you so much, Tate.